Thank you, Toastmaster, and to fellow Toastmasters and guests. When we think of things that are small and fragile and valuable, how many of you think carefully as you pick up something that is small and important to you? Anyone? Yes, I figured there would at least be a few. It's valuable things that are, well, they're very important, and something like a little china figurine is not likely to be just tossed across the room. Now, what I've wondered is that why are babies and toddlers very often different from, say, a china figurine? Because it's quite common to pick them up by grabbing them by the forearms, or even just by one forearm, and jerking them up, which really a lot of people don't think about, but it very often is the cause of what's called nursemaid's elbow. And when I think about this little fellow, you've seen this picture before. Of course, he no longer looks like that. But, now he looks like this. He is someone who is small and important, and I want to be very careful that we don't end up with something like this happening. His nursemaid's elbow is basically a dislocated elbow that's caused by lifting or swinging a small child by their forearms. It typically occurs, depending on who you talk to, by children under the age of 5, or under the age of 4, or under the age of 3. Couldn't really find anything that was definitive on any one of those, just found lots of information there. And when you think about a dislocated elbow, it also, it is another illustration. The symptoms of this are really extreme pain, an inability to bend at the elbow, and no desire to use the arm. It just will hang limp. And with the children being so young, they really cannot express the fact that I can't bend my arm. And I'm in a lot of pain. If a baby's crying, a lot of times you don't know why they're crying. So there can be a number of complications. Oops, didn't mean to knock that over. It's such as pinched nerves, or trapped arteries, or even something as bad as a fracture. And sadly, there is a higher risk of developing osteoarthritis in the future, which I'm sure that none of us would be interested in getting osteoarthritis. But treatment, preferably by a doctor, can be very simple. It's a procedure that is called reduction. And it's a maneuver of the arm to allow the bone to go back into place. It's quite easily. Of course, if the nursemaid's elbow is extremely bad, it can require surgery. So, regardless of how bad it is, the treatment of it should be as soon as possible, really immediate. Now, a lot of the reason for this happening to these young children is that the tendons and the bones are not fully developed yet. And so it cannot hold things in place as well as an older individual. So what I would suggest is that we treat children as they should be treated, with gentleness and care, because they're far more valuable than any inanimate object. And so we should not assume that we can just lift them up, yank them up, and that if they have some sort of injury that they'll just bounce back immediately. Very often children can do that. But bumps and bruises are typically not an issue. However, popping something out of the joint can be a problem. So it's best to lift them under their armpits. So be aware of the possibility that this may happen, and sometimes it will happen no matter how careful you are, but it's best to know how to handle it so that you can take care of it without it being a problem to these little ones that are so important.